notes and trying to memorize
Hmm.
everything that we talk about here.
Sounds
Makes
good.
it so much easier for me. So, just to get things started for you. So, my name is Melinda. I'm the marketing outreach manager for Charter College. I think you and I have met in the past when I was the campus president.
Hmm.
I've been with the organization for almost 13 years now. So I've held seven or eight different positions, anything from financial aid to career services to marketing, being the campus
Hmm.
president. And so kind of I've seen so many different, roles and what they look like. So I do enjoy that about charter college is being able, not getting bored and complacent.
Right,
um,
right.
but, just to, share a little bit with me about Grace Clinic, about your role and how long you've been there at Grace Clinic. I know it's been a while.
Yeah, it has been a while. So Grace Clinic was founded in 2002, and we're the only free clinic in our community. We provide medical, dental, mental health services at no cost to the patients. And we are able to do that through our network of volunteers, which includes students all the way through retirees. So it's a very cool environment where we will have students working alongside someone who's at the other end of their professional journey. So that's a very cool thing about us. I am the executive director. I've been with Grace Clinic since 2009. No, 2015, 9 years. I was aging myself. I was like, that's not right. It's 9 years. And I started in 2015. And I was clinic director for most of that time. And just recently, my title was shifted. My position changed to executive director.
Neat, neat. I think it's fantastic that we actually have a free clinic because we do have so many individuals that don't have health insurance or can't afford
Right.
to, go see a doctor or go see a dentist. And so I think it's fantastic that we have that in our community. So
Yes.
definitely thank you to Grace Clinic. Thank you to you. Um, so you kind of explained the different services that you provide. So medical, dental, and then mental health as well.
Yes.
Um, what you know, you talking about students and they're sitting chair side with maybe somebody that is a retiree or working to transition into that. You know, how does that work for the student? Success wise, do you feel like that they're building their knowledge that much better because we have just somebody that has been a medical provider for umpteen years or a dentist for so long?
I think one of the great experiences for charter students in particular is that they're here every day. And every day we have a different staff. So we have our consistent paid staff that we have our set schedule, but our volunteer team rotates in and out. And generally they're working half a day. So when you arrive on Tuesday, then there's going to be one group of volunteers in the morning and then a different group in the afternoon, and then Wednesday's going to be different than Tuesday, and Thursday will be different. So they get exposed to so many different provider styles, and I just think it's such a rich experience for them to be able to sit alongside these. Some of them are working professionals; they're still in the middle of their careers, and others are retirees. So they just get such a vast exposure to the healthcare community in the Tri Cities.
That is really neat. And not only just their style and how they prefer to do things, but also personality wise, right? So they have to
Yes.
be able to have those soft skills as well
Mhm.
as the skill set as a medical assistant, right?
Absolutely. And then we have some of our volunteers who are specialists. So the cardiologists will come in, the gynecologists will come in. So they also get exposed to some of those specialty areas as well, and not just general practice. So they're getting a really broad exposure by being here. And I think that's one very helpful to them.
Yeah, that's really amazing because also then thinking about it from a student perspective, that kind of gives them an idea of like, I absolutely love cardiology. And so I want to,
Mhm.
go and look, at least look about
Mhm.
working, right? Getting hired
Mhm.
in that field rather than say pediatrics. Maybe they're just like, I'm not a huge fan of kiddos, or, just
Right.
super excited about, birthing and,
Mhm.
OBGYN. So just getting a niche and a feel for the different specialties, and going,
Mhm.
okay, so this is my niche and I really enjoy it.
Yeah. And then along with the actual medical providers, the physicians, nurse practitioners that they're working with, they're also working with other volunteer nurses and medical assistants. And they also are coming from all across the community. So they're getting the chance to be exposed to them as well. They work at Trios, they work at Cadillac, they work in private practices all over the community. And so they're also working alongside them. So it's not just at the provider level, it's also at for their peers or who will be their peers. They are getting exposed to them as well.
That's awesome. I really like that. So with so many different volunteers and different individuals that, different days, AM, PM, and what have you, um, who kind of oversees the student to ensure that they are being successful, that they are doing what they should be doing, and, just confirming hours and, and their skill set? Would that be you? Would that be somebody else?
Well, in terms of the administrative side, I would be involved in that. And we have a very well orchestrated system. It's a well-oiled machine at this point. So in terms of tracking hours, arrival, departure time, that part of it, all of that is just a well-oiled machine. And we have a system on site that we use. They clock in, they clock out just like they would if they were working. Then on the actual clinical side, Connie Rohde is our director of nursing. And so she is their direct supervisor. She will bring them in terms of onboarding. She is their offers their day-to-day oversight. And then she is going to be working with them throughout the time that they're there.
Okay.
They're with
I
us.
like that. Yeah. So then they have that direct kind of rapport, and know who to go to if maybe there was an issue, concern, or even
Exactly.
just a question. They can go to Connie.
Yes. Yes.
Okay.
Hmm.
Yeah. I love that you guys you indicated it's a well-oiled machine, because I think some of the
Hmm.
newer clinics maybe that we have affiliation agreements with, you got to work out the kinks when you kind of first get things going.
Yeah. Well, this is what we do. I mean, as I said, our volunteer workforce changes every 4 hours. So because of that, we're built to flex, and this is what we do. We track when people arrive, when they leave, we get them scheduled. This is our life, our bread and butter. It's not like in an office where you have a set staff, the same people come in every day, and maybe there's shift changes, that kind of thing. But for us, it's a whole different crew. We will have well, it depends on the week, but we can have anywhere from 20 to 40 different people working in the clinic over the course of a week, or more. And so we have to always be ready to flex. We're built to flex. That's what we do.
And how many patients do you guys see in, like, on a daily, on an average day?
It really depends on how many providers we have, but we're doing about 700 patient visits a month. So that will be broken down depending on how many providers. So like today, we just have one provider, so it's a quieter day, but other days we'll have three. And so if we have up to three, then that means it's going to be a heavier patient load for that particular day. But by the
Wow.
end of the month, it's somewhere in the 700 patient visit number range.
That's a lot of patients.
Mm-hmm.
That's so
Mm-hmm.
that's so fantastic that Grace Clinic's there to serve that many people, each month, than just the volunteers and themselves. Um, do you guys ever see a student, like previous students, that go on and work and then come back and volunteer?
Yeah, we do see that. We do have students who come back and volunteer. The one thing we are sensitive to, though, is a lot of times when students, when they finish, they're really focused on their professional growth. And so we know that that is going to be a big focus for them. They've been in school, they're ready to get out there and tackle their new profession. And so sometimes that becomes a priority, and we're good with that. But we always have one or two who kind of stick around and continue to volunteer. The student who's here right now, she just said to me, she's like, oh, I'm coming back. I am absolutely coming back. Then there are also times where they may go into a specialty area and they want to keep up their general practice skills. So this would be a good environment for that. Or maybe they're, as they're looking for work, they will continue to practice here so that they can then be at the top of their game when they go right into the workforce. So yeah, so we see all versions of that.
Yeah, that would definitely make sense. Like if, they're seeking work and they just haven't found it yet. And so, they're just honing that skill set and so that they don't lose that.
Right.
Yeah, I completely get that. And that's another thing. Charter College has open labs, so individuals like that can come in and keep practicing skill set, or even current students that want to build on their skill set. And maybe they just didn't have, as much time during class, or, there's something specific that they're just not getting. Maybe it's injections or what have you. And so they come in and they get more one-on-one time with the instructors.
Yes.
Yeah. Yeah. Are there any challenges that you've noticed, or Connie, that students face as an extern at Grace Clinic? Like, is there one or two things that just kind of, they're like, this is something that, definitely they could work on more, whether it be skill set or soft skills?
I think in general, the charter students are very well prepared, and we've been very impressed with the level of preparation when they come in. They hit the ground running. They do a good job of integrating into the team pretty quickly. So we haven't had any challenges related to that. I think in general, one of my personal hot buttons is the soft skills, because I don't know how they're taught in programs, but I think that's what gives you the edge. So if you have two people who are both skilled MAs, as an example, because we see mostly medical assistants here. If you have two people who are skilled, but then you have one who has really mastered the communication, the teamwork, and some of those other organizational administrative type skills, that's going to give them an advantage. And so I think it's such an important thing. And I always think that there's lots of opportunity for that. We haven't really had issues in communication breakdown necessarily. So that's not really the point I want to make. It's more so that I just think it is such an important aspect of professional growth and development and achievement that it's just a big emphasis for me.
Definitely. I couldn't agree with you more about that. I think soft skills is just that one thing that sometimes you just can't even teach it. I mean, you can work, but it's almost like you've got to have that personality. I mean, there's certain things, of course, that you can teach, but or at least hone in on it a little bit more. I met with a director of another clinic yesterday, and she was saying one thing that really popped out at her was because it's a smaller clinic, so their MAs also answer phones, and there's many people that with the younger generation, they don't answer phones, right? Everything's texting and Snapchat and what have you, and so it's like, answer the phone, what? And so they're very nervous, and they're you just got to get it under your belt. And so that was one of the things that she said. I was like, I would never really think about that, but then I was like, I do have a 20-year-old daughter that mom calls her and she doesn't answer, and I'm, oh, let me text her, call your mom. And then I get a phone call. So
yeah, that is definitely true, because the phone plays a different role with the current generation than it has in the past. And so phone skills are something that they will need to work on. The other part related to that is we have sometimes had to have conversations about charting, because your charting is a professional communication. So it needs to be the appropriate register and level of language that's being used. So that is one thing we have worked on quite a bit.
Yeah.
Making sure that the charting is appropriate for a work setting. And we've even had this not just with charter students, but in other areas. So like someone working in reception, when you're recording a chief complaint for an upcoming appointment, what language do you use? And so we've been offering cheat sheets and little tips and tricks to make sure that that is communicated appropriately. And that's actually something I've done in the past. I've done classes with students, and just things like, you text your friends, but you write your boss. So even if it's a text communication, you're still writing to them. You're not, acronyms and, LOLs and IDKs and all of that. You have to actually, let's write it out because you're communicating in a professional setting. So those are some of the things I think are also important.
Definitely. I wouldn't even think about that in terms of like charting and, are they trying to use acronyms or abbreviations? Are they spelling things appropriately? Are they using the right verbiage or language?
Right.
And is it appropriate and professional? Definitely.
Yeah, exactly. Yeah, if someone comes in and they're having an issue with their backside, just to get really sensitive, what word are you going to type for that? So you got to make sure you're using the correct professional healthcare clinical terminology as opposed to what you would say if you were talking to your buddy. So
Yes.
so those kind of things are things that we work on as well.
I love that. I absolutely love that. So obviously students, what one of the questions I always ask is like, do they have the opportunity to train with more than one person? But yours is just like so versatile and so, just different from AM to PM, from Monday to Tuesday to Thursday to Friday. I think that is huge. I mean, I think that's immerging them, into the water and really just getting students to learn diversity. I mean, it's just amazing.
And it can be different from week to week. That's the thing. There is some consistency in our schedule. We do have some volunteers who come weekly, but others, they come once a month, twice a month. So it's really, we take it for granted because it's just the way we function. But from a student perspective, I can't imagine the breadth of experience and exposure that they're getting by being in this setting. So I'm really grateful that they get that experience.
As am I. So students, do they do, like, I know you guys are open Tuesday through Saturday. Do they do
Correct.
Tuesday through Friday, like 8 a.m. to 4 p.m.? What does that look like in schedule wise?
We close at 5 during the
5.
week, so
Okay.
they're generally here from 8 to 5, and then Saturdays we usually are done somewhere between 12 and 1. So it's a shorter day, which is half a day.
Okay.
Mm-hmm.
And with that, do you see that students are completing their required hours for extern in the timely manner in those 5 weeks? Are they getting those done?
We haven't had any issues unless there's like an issue of sickness or some illness that pops up. We haven't had any problem with the students completing their hours in that 5-week time frame.
Fabulous. And because you guys really rely on so many volunteers, I would presume, I could be wrong though, that there's not a lot of opportunities for employment once a student completes their necessary extern hours at Grace Clinic. Would that be correct?
That is correct. We do not do a lot of hiring. We haven't hired a medical assistant in probably, how long has she been here? 15 years or more.
Wow.
So yeah, our staff is very stable and small. So we have 13 paid staff. I think it equates to about 7 or 8 FTE because a lot of our folks are part-time. So there just isn't much opportunity. And and volunteers really are the bulk of our workforce.
Absolutely, which makes complete sense. So with that noted, does Connie, yourself, Grace Clinic, do y'all ever give like a letter of recommendation or referral to students as they seek employment elsewhere as a certified medical assistant?
Sometimes we do offer that. The other thing that is a huge benefit, and we've seen this a lot, especially on the dental side, but it's happened in medical as well, because they are working with so many different people. They often become aware of job opportunities because of the people they're working with. And especially on the dental side, we've seen this so much where a dentist is coming in, they're looking for a dental assistant. There'll be someone here. And we've actually even had people do interviews here right on the spot. So there is always that opportunity. And we do have some medical assistants, I think, that are working for the clinics of actually, there's been a couple, now that I think about it. They went to work with volunteers for the offices of volunteers that serve here. So that is the other part to remember, that when they're working, they're getting a little bit of a working interview in some cases. And I can think of a couple right now off the top of my head that ended up going to work for the private practices of volunteers who were serving here at the clinic.
Yeah, there's so much networking going on there.
Yes.
Yeah, with
Yes.
all the different volunteers, or maybe the
Mhm.
volunteer even knows of, even if it's not where they work, they know of
Right.
the healthcare industry is very like kind of niche together, I feel like. And so
Mhm.
like everybody kind of knows everybody, especially if they've been in the healthcare industry of the Tri-Cities, 20, 25 years. It's like, oh, Laura, hi, Sam, hi, Frank, like,
Exactly.
and so it's like, oh, Laura, I'm not hiring right now, but Samantha is, or,
Mhm.
Dr. Frankfurt is, so I mean,
Mhm.
it's really
Exactly.
just sharing that.
Mhm.
Yeah,
Yeah, and that has happened. That has happened multiple times here.
that is really, really neat. I like that. Um, Do you guys ever do, because I know you guys are so busy with all of, the just the community involvement, but do you guys ever do any health fairs, or how do you get out there and build awareness for the community that do need you? Or is it
Mhm.
kind of just word of mouth?
A lot of it is word of mouth. So we do track our patients' employment because they have to meet an income requirement or limit to be here, be a patient here. So we do get to see where they work. And what's interesting is we'll see a pay stub from a certain employer, and then we'll start to see more pay stubs from that same employer because they go back to work and they're like, oh, I went to Grace Clinic and they helped me with this or that. And so then their coworkers will start to come. So we do see a lot of that. We also do participate in different kinds of community outreach events. We're going to be at the Cinco de Mayo event in Pasco. They haven't done that one before, but that'll be a new one for us. We're doing a couple of events. Like there was one recently. What was it called? Community Resource Fair. It was held at the Union Gospel Mission, but it was
Oh, okay.
actually put together by the city of Richland. So we participate in that. We'll be at the Juneteenth Festival. We've done, what's it called? The Live at 5 at John Dan Plaza.
Mm-hmm.
We've done those. So we do a lot of those kinds of events as well. So
Okay.
to get the word out there, we do a ton of social media. So we get a lot of interest through social media. And so we do get out there, and we hope to do more of, like you're saying, the health fairs. For example, one of the initiatives we have this year is head and neck oral cancers. So we want to put some information out there. So at our booth, the next booth we'll have some information about those oral cancers, just to help people start to look for signs and symptoms. If you have a lesion in your mouth, you have a bump on your tongue, you have something going on in your mouth that you've been ignoring. Well, let's not ignore it because that could lead to something more serious. So we'll be doing
Okay.
more of that this year.
Yeah. Awesome. Well, I know that Charter College does a lot of, different, college and career fairs, a lot of health
Hmm.
fairs. I know of one, and I don't think I saw you guys out there, but I think they changed the name, but it was Vista Hermosa. It's out there, Prescott
Hmm.
area.
Hmm.
And that one's huge because I think, just our agricultural workers, they
Hmm.
definitely don't make a lot of money. And so, I
Hmm.
mean, that may be something really good for you guys as well.
Yeah, we did one that it was held at the Center for Sharing, but I can't remember what it was called. We haven't been actually to Vista Hermosa, but done another one. Was that Time Runs Together? So I want to say it was this year. It could have been last fall. I don't remember, but I know we did one recently. And then yeah, we try to get out there as much as we can because
Yeah,
it's a good, important way to inform the community about that we're here and that we're available.
Absolutely. And I'm just so impressed with Grace Clinic and everything. I know that I have family members that have visited there, and they can't say nothing but good things about your clinic. So thank
Oh,
you for
that's
being in
wonderful.
the Tri-Cities.
Well, yeah, we appreciate it. And we're really grateful for the partnership with Charter. It's been really a win-win for us to have the students here. Like I said, they're well prepared. They come in, they are helpful. Like I used to tell my kids, make sure your help is actually helpful. They actually are a benefit. Sometimes with students, it can be a little bit hit or miss because they're maybe not quite up to a skill level or competency level because they're still learning, which we expect. But the charter students across the board have been very a great fit for our team. So we're grateful.
Yay, that's so good to hear. That does my heart good. Well,
Yeah.
Avonte, is there anything else that you would like to share about Grace Clinic before we kind of end our call today?
There are lots of free clinics across the state and the country. And as I interact with them, I can tell the strength of the clinic is really dependent on the support of the community. And Grace Clinic works well because the community responds to the need and through volunteers and donations and just the partnership and collaboration. And the partnership with Charter is an example of that. So we're grateful for the support that we receive.
Absolutely. And just if somebody wanted to donate, how can they go about like donating, whether it's, $5, $10, $100, how can they go about doing that?
Through our website and also Facebook. I mean, that's another way people can donate, but yeah, just through our website we have a donate button where people can contribute, and then also through our social media.
Fabulous. Well,
Yeah,
Monty, thank you so much for meeting with me today.
thank you. I appreciate the opportunity to chat with you, and if there's anything else you need, anything coming up, please let us know. We look forward to expanding. I think there's an opportunity to work with dental as well with Charter, so we're looking forward to growing that.
Definitely.